Hey guys, what's up? So we are doing some telehealth, working with some simulated patients. If it weren't COVID, we would be doing this on campus. But since we are in COVID, we get to do it over telehealth, which is over the computer. And let me tell you, it's interesting, I guess. It's definitely different. Creates a whole new world for delivering healthcare. Definitely super true. Of course, we all know the hack of how to do meetings over Zoom, which is, your top half is like your white coat, everything looks great. I even put on some like lashes and like eyebrows because I don't have any. And then you get to wear like your Adidas like sports shorts and your blankets right here. So you're just like keeping comfy. So yeah, that's what we're doing right now. And today I pretty much just did my normal like COVID learning. Everything is online, obviously. And so that's what I've been doing. We're gonna go ahead and take the doggos on a walk after we're done doing this next patient. The patients that we were doing today, we were working on breaking bad news. So we worked on telling a patient that they had a abnormality with their mammogram. And then I'm doing another patient that is with smoking and kind of motivational interviewing on how to like stop smoking, that kind of stuff. So it's very interesting trying to tell someone that they're wrong, but you have to do it. No, I can't say that. So yeah, that's kind of like what I'm doing today. And this is what telehealth looks like for a med student practicing telehealth, especially since we can't be on campus. And so yeah. Okay, so we just finished our second patient encounter, which was the smoking cessation one. And now we're gonna go grab the dogs and they're gonna freak out, and I'm so excited because they always get really excited to, I don't know, they always get excited to see you. Kind of to show you a little bit of my setup right here, I did throw up my ring light. Oh my gosh, it just makes a huge difference whenever patients can see you clearly, and it just makes it look a lot more professional with something that costs so cheap. So I do have to finish up a checklist thing that's kind of like, how did you do, blah, blah, blah. And so here's my iPad. I kind of take some notes on it whenever I need to. A shake that I haven't finished because I worked out, of course, right before. Unopened LaCroix, which that needs to happen. It's really nice to have your own space in medical school or like working or studying in any capacity because, if you need to like put the dogs away, or if Eddie is home and he needs to be in the other room, and like that's just a distraction that you don't need. So it's perfect to have this space and totally recommend it. So let's go grab the dogs. I'm also gonna change and we're gonna go on a walk. Hi, boys. Boys. Oh, yeah. I don't know if anyone has dogs, but they just know things, and he knows. Honestly, like, how? I know, I gotta get let me get my shoes on, wherever they are. Alrighty. Oh, come on. Hey, stay. We're gonna go on a walk. There's Chuck. So for dinner, I threw together some tilapia that I just had on the skillet with some olive oil and then some Brussels sprouts. I also had some rice, and I threw some hemp hearts on there, which was super delicious, and I enjoyed that it gave some more nutrition and gave it a nutty flavor. Sorry, that's a little louder than I thought it was gonna be. So The Office is on in the background, and literally it's just, I honestly could watch it for the rest of my life. Like, it's just one of those shows. Anyway, I know I talked about it in my first video, but I will literally praise that show until my dying days. So right now I'm working on doing some EMS assignments, like online with our EMS system. This is just kind of a way to get like our CEUs and to make sure that we're kind of staying proficient in a lot of different areas of healthcare and like actual EMS techniques and things like that. So that's what I'm working on right now. And this first one is EMS Behavioral Emergencies Advanced. Long title. But anyway, which is literally what I've been learning the past 2 weeks in med school, involving like psychiatry and just looking at like different psych disorders. And so I just thought that was fascinating. Anyway, so that's what we're doing for almost the rest of the night. Then at 7:30, I will get on a Zoom chat with a couple of prospective students to my school, and just a way for them to ask questions to current students, and just to, you know, kind of something that is like super laid back, and they're not going to be judged in any certain way. We don't have any say in like their interview process and like their rank or anything like that. So that's what I'm going to do for this evening, and we're just going to hang out. We are finishing up the video. Thank you so much for watching. If you enjoy this content and want to see more, please go ahead and click that subscribe button, and feel free to leave any comments or questions, and I would love to answer. Thanks.